What's up, y'all? I am Ofosu Jones-Quartey.
And I'm Leah Santa Cruz. We're the meditation coaches on the Balance app.
And this is our weekly show, Well Balanced, where we explore ways to live a healthier, happier life.
And today is World Mental Health Day. This is a holiday that's promoted by the World Health Organization in order to raise awareness and increase support for mental health around the world, which we totally support here.
Yes.
And this year, the WHO's theme is Make mental health and well-being for all a global priority. And so we've got a psychologist here who's going to help us understand how where in the world we come from, our families, our communities, affects how we talk about mental health and how we treat it. Her name is Dr. Miwa Yasui. She's an associate professor at the University of Chicago's Crown Family School of Social Work, Policy, and Practice. And she's here with us now. Hi, Dr. Yasui. So great to have you.
Hi, very nice to meet you both, and thank you for having me on the show.
Our pleasure. Wonderful to have you. So, Miwa, when I found out that we were interviewing you and what your focus and discipline is, I immediately thought of my father, my family's from Ghana in West Africa. And my father is obviously an immigrant, came to this country a long time ago and studied psychology at American University. When I was younger, he would talk a lot about challenging his professors at AU who were looking at psychological conditions through purely a Western lens. And he would say that, well, in Ghana or in my part of the world, we don't look at it that way. We see it maybe completely differently or just from another angle. So for me, it brought up this idea that where you come from has a real impact on your psychological interaction with the world. So I feel like your research is connected with that, and you've done research in the States on mental health in immigrant communities. And out of that, you've developed a tool called culturally infused engagement. And that tries to take culture into account when treating mental health. So could you please elaborate a little bit on what culturally infused engagement means and what inspired you to start working on it?
Culturally infused engagement really refers to how culture influences how people think about mental health. So the ways in which different cultures might think about what constitutes mental distress could really vary. And so from the conceptualization through even the experiences that a person has of the mental distress, how does it impact them? What are the ways in which they expect their life course to be? How do others around them respond? And then how they respond to that, either through finding particular help-seeking sources that could include mental health services, but also could include a variety of more culturally specific sources of healing. And so when we think about the process of engagement into finding help, it is culturally infused. And you ask why it's important to me. For myself, throughout the course of my journey as a clinical psychologist, seeing clients from various different backgrounds, and oftentimes I met with clients who were from very different cultural backgrounds, whether it be by race, ethnicity, socioeconomic status, nationality, religion. What I found that as I engaged with them, the ways in which they thought about their mental distress wasn't always the way that I thought about it, or even how I was trained professionally. And so I came to realize that it's really important for the person who is experiencing the distress to understand it from their frame of reference and not always move forward with a professional lens in how we conceptualize mental health and identify ways of treatment, because oftentimes that could actually go against how people from different cultural groups think about their distress. And it actually could even deter them from finding mental health services, particularly if they think that, for example, having the clinician telling them, oh, you're struggling with depression, or you have this diagnosis of bipolar disorder, how that can be a huge detriment for both their self-concept, but also when they think about their cultural community, that they would fear the stigma from people.
You talked about the way that you might think of mental distress could be different than the person you were speaking to, and to kind of jump outside of the lens of your traditional thinking. Could you share a story of someone in particular as an example that maybe benefited from this approach?
Yeah. One of the clients that I had interacted with, they were Cambodian American, had gone through the Khmer Rouge genocide. And so they themselves had gone through significant experiences of torture and violence that also continued to affect their mental health to this day. And much of the distress that they were experiencing was very physical. And granted, I come from an Asian background, so I understand that some distress, even from my own culture, is manifests somatically, which is kind of physically. But my training in psychology obviously has this lens of thinking about mental distress or psychological problems from a very cognitive, emotional, behavioral framework. And oftentimes the physical manifestations of distress, it is included, for example, in, let's say, symptoms of anxiety or even some symptoms of depression. But it's really a domain that oftentimes when we think about the medical field, it's separated out. If you have physical problems, you go to the primary care physician. If you have mental health problems, you go to a psychologist, a social worker, a counselor. This was actually relatively new in my training when I was working with this client. And I realized at some point that he was reporting that he wasn't experiencing distress, but it was because the particular assessment that I was using was focusing on more of the emotional and psychological symptoms. And this was not matching up with the neck pain that he was experiencing, the sense of indigestion that he was experiencing. So I ended up sort of putting my clinical tools aside. And I just sat and asked him, how are you experiencing the distress? And then I came to find out that the neck pain was something that he experienced a lot. And then he described to me, it reminds him of when he had to go through the forced labor. During the Khmer Rouge, a lot of people will have to carry very, very heavy buckets of, it could be either mud or rice. And they would have the buckets on this wooden pole that would be on their neck. And it would pressure them. And it was interesting because he mentioned that it would remind him of that time that he would have to carry those buckets as a teenager, and the pain and the fear of having to go through that exhaustion and fear that if he didn't continue to work, they could shoot him and he had to keep on working. I only came to understand from my client's narrative how a person's understanding and how they experience that distress really has to be captured from their own framework. And while we definitely have tools, it's really important to hear the perspective of the client.
This is really fascinating. And I appreciate that you had the courage and the foresight to set aside the primary lens that you were examining them through and really ask them to report to you what the totality of their experience was. That strikes me as, I'm not sure. Is that common? Like, how are your colleagues handling situations like this? And in the work that you're doing, what has the reaction been from your peers?
I would say at the core of what a clinician wants to do, yes, I think that all clinicians seek to meet the client where they're at. And even across different disciplines, cultural competence, cultural humility is something that is even within kind of our code of ethics. And so that is really important. I think that how it manifests can really differ because I think the training on cultural competence and cultural humility.
I need to interrupt you.
Oh, yes.
Because these are powerful words right here. Especially cultural humility. I'm super interested in that. Could you just give us like the Chicken McNugget version of cultural humility? What are we talking about here? I love these two words.
Cultural humility is really an attitude or an approach that one engages in to understand a client's world. And it's really having this position of humility, recognizing that we will never fully come to a level of competence of really knowing our clients and how culture might influence them in terms of, I had mentioned, how they think about their self-concept, their family, how they might think about mental health. And it has to be something that is held throughout the course, that we will never grow out of having to be in a posture of humility when we come in contact with our clients. And again, I think in the literature and cultural competence, they are not touting that you reach a certain level of competence and therefore you're a culturally competent clinician. There's actually no such thing. You never reach that. The reality is being culturally competent in the domain of knowledge is, are you acquiring the knowledge base that is necessary for the particular clients that you're serving? Have you looked to educate yourself on their history, their migration pathway, what might be their cultural values and belief systems, what might be their family structure? These are things that are really important to build that knowledge base. The second dimension is that we need to recognize our own limitations. Every one of us has limitations in terms of how we think about others. It's always through a particular lens, right? Who we are, how we were raised. And so coming to face with the biases that we have, whether it's regarding race, gender, sexual orientation, religion, nationality, or ability, these are things that we may unconsciously have just because of the upbringing, what we might have been socialized with. And so realizing that is important.
So for someone who's on the treatment side of this, someone who's the patient struggling with their mental health, and they come from a different cultural background than the professional or the psychiatrist, or maybe they're just not fitting the norm of the typical, this framework of what we use in the United States, for example, is designed for primarily a certain class of white American. And so when we talk about different cultures, what does that mean for the patient themselves who needs that culturally aware care? And they go in to ask for support in mental health. What do you recommend to that person? What can they take away from this that you'd like them to know that can help improve their mental health journey?
Oftentimes these are concepts that they're not going to think about, right? They're coming in to see somebody and they want help. And I think that it would be a lot to put on to the client for them to have to navigate. Does my therapist, does the clinician, the counselor who's in front of me understand me? But unfortunately, this sometimes is the reality for some of the clients. They come into a room, they share their story, and then they find that their clinician does not understand or may discount some of their struggles, and then they feel unheard. And so for a client coming in to seek mental health services, one thing I might suggest is, although it also puts the onus on the client, which sometimes really burdens my heart because they are already in a place of struggle, try to identify people who you feel like you might be able to resonate with. Now, this could be, they might be from the similar racial background, or it could be gender or religion. I think that helps you at least identify a clinician that hopefully will understand part of your worldview. But if there are people around you who have gone to clinicians, therapists, counselors, and they've had a good experience, ask them about that. Hear about what worked, why they found that clinician was helpful, because it doesn't necessarily always have to be that you have to be from the same racial group or the same religion or same gender. Sometimes it could be really different, but that clinician really took time to listen or did not say things that the client felt like was judgmental. So I wish there was kind of a magic bullet or, these three things you can do. But oftentimes it does require meeting the clinician and getting a sense. And I would say once you start meeting a clinician and you feel like you're not clicking, that's okay. Because again, the clinical process is a process between two people. And so you have to figure out kind of the fit. And it may not be that, it might not be anything to do with, let's say, the skill level of the clinician. But it's important for you to know what if you feel heard, if you feel respected, and allow that to kind of guide you, I would say, in finding the clinician for yourself.
Thanks, Miwa. I've been in various therapies my whole life since a child, and I'm a strong advocate for people, even when we work in the wellness industry, or especially every therapist I know has their own therapist, right? So I've certainly met therapists who I didn't click with at first, and or I went through a few sessions and go, okay, well, this isn't working. So, and I think it's great to share that people can trust their intuition with that and not always take what someone's assertions are as truth.
Yeah.
And I also think that this framework that you're offering of culturally infused engagement seems like, anywhere you go. I live in Bali, Indonesia, and, I have a therapist who's from a very different cultural background than me. And I think this is the framework that could be used beyond just the United States. Like as we are in other parts of the world and the world's becoming more global, we have so many mixed cultures in, whatever city, London, all around Europe and Africa now. So I think this is really helpful for everyone worldwide.
Yeah, I totally agree. I really appreciate this conversation because it did bring me back to those days listening to my dad just basically sharing that you really do have to understand where someone's coming from as much as you possibly can. Like you said, cultural competence is not a goal, but there are maybe tiers or domains. But yeah, that you really need to take into account where someone's coming from and let that frame of reference inform how you treat them. So this is super important, and I feel really empowering on both sides. So thank you so much.
Thank you.
Okay, I'm going to call you Dr. Miwa, if that's okay.
That's okay.
Thank you so much, Dr. Miwa. We had a wonderful time learning from you and listening to you share so many fascinating ideas. And we hope that maybe we can talk to you again in the future.
Yeah, thank you so much for having me. It was such a pleasure. And I'm so glad that, your audience is global, how you're really sharing mental health and wellness, at a global level. That's really very encouraging.
Yeah, thank you. Well, you're a part of it now, so we're all doing it together. Okay, friends, you can learn more about Dr. Miwa Yasui's work at the link that we have in the description.
And if you're not watching this podcast yet, go check us out on YouTube. Our channel is called Balance, and we've got a link to today's episode in the show notes.
And if you want to get the latest audio versions of our episodes, you can follow us wherever you get your podcasts. We are literally everywhere: Apple, Spotify, Amazon Music, and more.
And we're going to be back next week. But until then, have a beautiful week.
Don't forget to be kind to yourself. Take care and adios.
Bye-bye.